The question is, would you expect it to be harder to treat a TB infection when the bacterium is in latent form, and why? Um, I don't think that it would be harder to treat the bacteria when it's in latent form, when considering like actually trying to kill the bacteria. There's less bacteria when it's in latent form. That means there's less um, bacteria that we need the medicine to kill. TB is a really slow growing bacteria, so it would be easier to kill when it's in latent form. The difficult thing is the compliance. I imagine that it's more difficult to treat it in that respect because patients are asymptomatic, they feel fine, and they need to be on antibiotics, or not antibiotics, but these like the rifampin and the isoniazid for a long time, like 3 months, 6 months, sometimes up to 9 months for treatment. And then sometimes they have the direct, like, observed therapy where they have to take the medicine in front of someone. A lot of the times, like I said, they feel fine. And so it's a really long time to be on medicine, and there's a really high rate of noncompliance, hence the DOT. The direct observed therapy is necessary because people don't take the medicine the way they're supposed to for as long as they're supposed to, and a lot of that medicine has like hepatotoxicity and other side effects that go along with it. So I think when you take all that into consideration, treating latent TB can be more difficult than treating the active form because the compliance issue, though they run into compliance issues with active infections too. I just think the length of time needed makes it more difficult to treat. And then if you don't treat it, or if they don't take the medicine as long as they need to, then they could develop the multi-drug resistant form of TB, and that would be much more difficult to treat because it doesn't react to it's resistant to the first line medicines, and then the extensively drug resistant, which is resistant to the first line and second line medicines. Like, that's the problem you can run into when people aren't compliant with the medication regimen. So the ethical question is about a patient that's infected with the extremely drug-resistant form of TB. They're refusing to follow the doctor's orders. They plan to go out to dinner, fly on an airplane, and live their normal lives. Is it okay for that patient to be put into jail until treatment is effective? I do think that is ethically okay. But before that step is taken, I think that whoever is treating that patient should look into why. Is it an education issue? Do we need to educate the patient on how contagious TB is, who all they're putting at risk when they choose to go out and do these things? Is it maybe a monetary issue? Where, they need to be able to work, or, in order to pay their bills and to feed their family. So what's really behind? I think it's important to figure out what's behind their unwillingness to comply before, they're taken to jail. But in a case where, they just won't comply, and education has been implemented like several times, then I do think that it is okay for them to be taken to a place where they can be kept under closer supervision, and the DOT can happen so that we can ensure that they're being properly treated and that we're not infecting more people, because TB is highly contagious, and there's a lot of people out there. I think the video said 2 billion people worldwide are already infected with TB. So, yeah, I think in some cases that when it's necessary for the greater good of the population.